Hey folks, I want to take the time to thank you for clicking on this video today. What we're going to be covering over the next couple of minutes is the most common or top mistakes agents are making during this AEP. My name is Matt McVay, and I am the Senior Outreach Coordinator for Senior Marketing Specialist. I have had the privilege of spending the last 5 years working with and advising agents who are passionate about this industry, as well as assisting their clients with every need they have. And hopefully, this video is going to assist you in that endeavor. Again, what we're going to go over are some of the top mistakes we're seeing so far during this AEP by agents when they're submitting applications. The first one of those is going to be using the incorrect app. Seems like a small thing to miss, but carriers are constantly updating their applications through the process. So I'd say if you have not written with that specific carrier in that specific state in about 60 days or so, please utilize our website, our support team, our Medicare Center quoting tool, or the carrier portal itself to make sure you have the most up-to-date and accurate application. It can be something as small as a date correction on the bottom right corner, all the way to a new book of business name, or an entire rebrand of the application that will cause this application to be denied and or pinned for many, many weeks during AEP. Secondly, make sure you're using the correct application for the correct state. Many of the big carriers have multiple names they go by, depending on what area you're in, and those names are constantly changing over the years. Make sure you're using the right carrier, the right acronym, the right application for the area you're working in. And again, please verify that by calling our 800 number, talking to our support team, or using our website to make sure you have the most up-to-date, accurate information. Second mistake we're seeing a lot of is going to be using an invalid enrollment period for an anniversary. As you're noticing, a lot of the states now are changing the anniversary rule or birthday rule, which means that clients have the option with Medicare Supplement to enroll in a different plan without going through underwriting. Now, the thing you need to pay attention to and avoid the mistake of making is using the wrong enrollment period. Each state varies on what their enrollment period is. Here in Missouri, it is 30 days prior to the anniversary date itself, and 30 days post the anniversary date that an application can be submitted with an effective date without underwriting. So please double check, make sure you're using the right enrollment period for your state's specific birthday or anniversary rule. Now on to mistake number 3. What we're seeing with mistake number 3 is enrolling clients or disenrolling or enrolling a client in a Medicare supplement before everything is set up properly. If you've got a client who is going from a Medicare supplement prescription drug plan combo to a Medicare Advantage, you have to ensure that that Medicare Advantage coverage is effective before you terminate the Medicare supplement. Also, what's important is to keep in mind the prescription drug plan will be terminated as soon as the MAPD goes into effect. On the opposite side of the coin, the same thing is true. If you've got a client going from a Medicare Advantage or an MAPD to a Medicare supplement and prescription drug, you have to ensure that you have pre-qualified, enrolled, and have an effective date on that client's Medicare supplement prior to the effective date on the PDP going into effect. Because just like with the Medicare Advantage plan, as soon as that PDP goes into effect, it will terminate existing coverage with the MA plan. And if you do not have a Medicare supplement approved with an effective date, that client will be without health coverage during that time period, and that's something none of us want to have our clients experience. The last mistake I want to touch on real quick is going to be making sure you are appointed in any state you're doing business in with the carrier writing that business and that you are certified ready to sell. Most carriers will go ahead and honor the policy and get the client coverage. However, on the agent side, you will not be agent of record. You will not receive commissions. And by making a mistake, innocent or not, you might have a license in that state, but you didn't get your appointment with the carrier or didn't verify your ready to sell status and state appointment with the carrier prior to writing. This could lead to both investigations from the carrier and CMS, fines and penalties, and suspension or loss of contract for cause, which will make it very hard to get future contracts or future carriers or continue to work in the industry at all. So please take a moment and verify your status with all the carriers you're writing. You can do that again through Medicare Center, Medicare app, our support team, our website, or calling the carrier directly and double checking your status. Thank you again. Feel free to reach out to us at any time at our 800 number, 1-800-689-2800 with any of your questions. Take care, and I'll talk to you again soon.